Happy Sunday, everyone. How's the weather over there? So we're starting the family clinic in another 2 minutes. No, in a minute now. So we're not going to stay too long on the program tonight, but it's going to be very, very interesting. I'm trying out to so that okay. So good evening once again, happy Sunday to everyone. This is Family Clinic, and this is how we do it every Sunday. By the hour of 8 p.m. like this, we treat family issues, all issues bordering on marriages, homes, relationships, our life, every issue bordering on us. Yes, let me use that word, us. And this is Family Clinic once again. Today, just as I said that every edition of this life counseling session is going to be interesting and is one that you shouldn't miss out. Tonight we'll be talking about the importance of knowing your genotype. So before we go straight into the business of the day, please, if you're online or you're watching, so that you will know that the audio is good at the other end there, please send me a comment that the audio is loud and clear, or just send good evening so that I will know that you can hear me. While we wait for our guest for tonight, tonight I told you it's going to be interesting because we are going to be, for those of us, though I will not like to blame anybody for some past issues or events, but in this dispensation now, there are some things that we should have known. So in case we don't know now, we want to remind ourselves, or we want to reorientate ourselves and orientate ourselves to about some costly mistakes that we should not fall into. And for those that are falling into such mistake already, if there are no remedies, if there is no remedial action that they can put in place, they can actually do some things to manage it. So that is what we're looking into tonight. And just as I promised that I will be on every of our program like this, I'll be advertising for free, yes, for free. But I said terms and conditions are applied. You must be a follower. That is, you must follow me on my Facebook account, Tony Olusa. Then you must be a supporter of this family clinic program. How do you support the program? By making sure that you attend every of our fresh edition of the program, comment, like, and share. That is our ticket for a free advertisement on the program tonight. So just as I do every Sunday like this, like we do every Sunday like this, I will be adding our guest for tonight on the program. Tonight promises to be interesting, and at the same time, we're not going to take much of our time. It is possible we don't spend 1 hour on the program tonight. I already sent a request, an invite to our guest, which I believe, because in the afternoon we try to have, we had a test run. Yes, we had a test run of the program so that we will not have any issues in linking up tonight. So Dr. Adebayo, if you're watching me, can you just send me a comment? Thank you very much for coming on the program. Yes, I can see you are watching now. So what happened again? Is it a connection? I missed that. Okay, thank you very much. I will be adding you up on the program now. So I'm trying to add you up, and I believe the network is going to be good tonight. Yes, tonight's promises to be interesting. Network is going to be very good. Yeah, it's good to have you on the program tonight. Dr. Adebayo Ajodele, it's good to have you on the program tonight. Thank you for obliging and honoring our invite.
Thank you, ma.
So
Nice to.
I believe you can hear me.
Yes, ma'am. Good evening, man. Nice to be on the platform. Nice to
Thank
be
you
here.
very much. You seem to be somehow busy because you are not set for this, but we would like to, to be seeing you. Yeah, I think this is better, and I thank you very much for that. It promises to be very short tonight. The program is normally an hour, but tonight we'll not be spending up to that, but we will deal with the real discussion of the day. Will you like to give the audience a brief introduction, or you are cool with Dr. Adebayo
Dr. Ade-
Ayodele, a general practitioner, sir?
Dr. Adebayo is fine. Dr. Adebayo is fine.
Please, can you just kindly help us to stabilize that camera?
Okay, sorry. Dr. Adebayo is fine. Thank you.
Okay, Nini Bella Motola, yes, the guest is already on the camera. Thank you very much. She's already here. So just sit back and enjoy every bit of the program. So, Dr. Adebayo, without much ado, let's just go straight to the discussion of the day. Do you hear me?
Yes, ma'am. I'm with you.
So, we want to talk about the importance of knowing our genotype. First, what is genotype, sir?
Okay. Genotype is, in simple terms, is put as the genetic information an offspring picks from both parents. The genetic coding, the genetic information a child picks from both of the parents. This is where they pick the resemblance from one parent and the other parent. So whatever information you're looking for in a parent, you can find in the offspring, and this you can see in the genotype.
Thank you very much for that. But I don't know. The audio is somehow, the volume is not. Maybe you help
Oh,
us
okay,
to.
okay. I'll speak up.
Okay,
I'll
I
speak.
think this is better. So you've been able to tell us what genotype is. I don't want to be too forward in this because I'm not a professional on that field, but with my little knowledge, I'm able to understand that we have different types of genotype. Can you
Okay.
briefly analyze this to us?
Okay. I was about to get to that. There are various types. Just like I said, is the genetic information you pick from both parents. And we have types of it. Some are safe. The combination of some are very safe. Combination of some are not safe at all. We have the genotype of AA. We have that of AS. And we have that of AC. Then we also have the genotype of SX. We have that of SC. And we have that of SC. So these are the major five that we have. However, combination of AA is fine. Combination of AS is also fine. Combination of AC, it's mildly accepted. But the combination of SS, SC are not, or yes, they are not welcome at all. The complication is so bad, and there is something I've discovered with sickle cell patients. It's something that those who pay the real price are the parents. Those who pay the real price are the relatives. I've seen in the hospital where, fine, the patient might be in pains on bed, but those who are really going through pains are parents, relatives of that particular patient. So it would be very nice for us to know that before I do tell my patient that before you say yes, I love you too, so far you know that you are SC or AS or AC. Before someone tells you that I get your number, the first thing you should say is what is your genotype? Before you even answer any other question, what is your genotype? Because that will go a very long way to helping us in the future. And the importance for us to know our genotype is that, number one, it saves costs. What I mean by that is this: most most parents will come to the hospital having a sickle cell child, and they can't afford hospital bills at all. They can't afford hospital bills. And this is a child who is very sick that needs urgent medical attention, and they can't afford it. So, knowing our genotype, preventing the combination of the bad ones will save us costs. Then it will save us early death. When we were in secondary school, our parents would tell us, don't play with girls, don't impregnate any girl, face your studies, do this, do that. But when it comes to SS children, at primary school, they are already introducing them to the opposite sex. Why? Because they want the child to have, at least, to have an offspring before they lose that child. There was a time I saw a boy who is still in part 2 in the university, very young guy, and they were already encouraging him to have girlfriend. Even if he impregnates the girl, they don't mind. They don't want to know. So, and I saw the psychological trauma the parents were going through. So, knowing our genotype will save us from early death, will save us from costs, like I said, then will save us from health issues like organ failure. Because the red blood cell that forms a sickle shape, that is why it is called sickle cell anemia, that forms a sickle shape under tension, under low oxygen, under cold weather, and other extreme conditions. Maybe climbing a mountain, they form a sickle shape. They become polymer in nature and in texture. These sickle cells, these red blood cells, they are the ones who transport oxygen to vital organs. And when they form sickle shape, they can flow through tinier vessels. And when they can't do that, there is limitation in supply of oxygen. And if this is happening, there might be major organ failures. So, such a person will be in a very bad health shape that may not live long, so to speak. So, knowing our genotype will save us costs, will save us psychological trauma, will save us the trauma of making some decisions, even when we are not prepared, even when we are not matured to take such decisions. Because when you are telling a guy who is still 19, 20 years to, and you're already discussing as a parent with that child, with that boy, about marriage, this is something he's not prepared for. He's not ready for it. He's not matured for such. He's not financially. He's not prepared. You now see such period. They will not be financing the wedding, financing the boy in his home. So it's like pushing a premature man into marriage, all because of genotype. So if we can know our genotype, it will save us this stress, and it will save us the losing our parents in a very early stage. I don't know if.
Thank you very much, Dr. Adebayo. I was about asking you
Okay.
the importance of knowing our genotype, but you've been able to do justice to that. And I believe that our audience have learned one or two things from that. But
Okay.
dwelling on this genotype SS and
Yes.
ST, when we were growing up, I don't want to call it a mythical belief anyway, but
Okay.
there is this saying that there's a particular age that this uh this carrier, that is the particular age that they get to, that should they have the opportunity of achieving that age, then they will be able to lead a normal life. Is there any truth in that?
To a small extent, there is a truth in that. However, um, health is individualized. It has to do with each individual. Uh, when it comes to health status, it can be much generalized. For example, if you have someone who takes care of him or herself, that helps prevent the cells from going sickle, such a person can still live a longer life. But in a case where this person is not wealthy, doesn't have enough money to even buy pure water, to take enough water, doesn't have enough money to live in a conducive environment. The environment is always polluted. There is always air pollution, and such a person can't afford to live in a comfortable environment. You can't expect that person to live long. Even if the person is not a sickle cell patient, you can't expect such a person to live long. Because anytime the red blood cell sees an extreme condition of pollution, the red blood cells become sickle in shape. And someone who is living in a place where the soakaway is, the septic tank is always smelling out, reducing the level of oxygen they get from the atmosphere, I don't think such a person will live long. Someone who is sick of malaria, who has a vaso-occlusive crisis, and there is no money to take him or herself to the hospital. First, they go to a pharmacy, chemist to get drugs. Or maybe a patient who is always in pain. One came the other time, there was swelling all over the body because she's been injecting herself with pentazocine injection, with diclofenac injection, with tramadol. She's been injecting herself. So such a person might die of drug overdose due to renal failure, because every drug we take, the kidney and the liver will have to scrutinize them to break them down. So if you the liver performs more than 500 functions in the system. So if you overload the liver by taking excess drugs, taking excess medication, you can affect the kidney, you can affect the liver. So such a person, I can't guarantee that is going to live long.
Thank you very much, Dr. Adebayo. Uh, while we were preparing for this program, I promised my people that we are not going to be judgmental on the program tonight. We're not going to be biased, and we're not going to push blames. What I mean by that is we're not going to say the parents are at fault for producing offspring with health issues. No, we want to blame them. Though in court, we may want to say, why didn't they have done this to prevent such occurrence? Now, it has happened, it has happened, just like the Yoruba adage. Wọ́n ní ọ̀bẹ ti gé ọmọ lọ́wọ́, ọ̀bẹ ti ṣe iṣẹ́ ọwọ́ ẹ̀. Apologies to the non-Yoruba speakers. What I mean is that the deed is already done. Now, we cannot even, we cannot even remedy that, I believe. But what are those things now for people that find themselves in this situation? The people, the carrier of sickle cell anemia, what can they do? Maybe as an adult or a grown-up, one that can actually take care of his or herself. And secondly, as parents now, the deed is done already. We have decided to do it, and nowhere we have these children. What are the preventive measures? What are those things that we can do to minimize these their health challenges or problems or occurrences?
Thank you, ma. Like you said, the deed has been done. If this will go to everyone, not even the sickle cell patients. Like, the weather is very cold now. Even those who are not sickle cell are falling sick. The hospital is being increasingly visited now, even by those who are not even sickle cell. So what everyone should do, including those who are sickle cell, is that they need to study their body. If you realize that, especially when it comes to cold weather, or when it comes to choky rooms, stuffy rooms, they need to watch for it. Parents need to put on excess clothes for their children who are sickle cell, so that they don't get exposed to cold, because the more the cold weather, the lesser the oxygen, and the lesser the oxygen, the more the blood, that red blood cell, goes into a sickle shape. So we need to prevent them from cold, we need to prevent them from dust, we need to prevent them from being overusing their body, that is, going through rigorous stress. So such a child needs to be monitored. And if the person is an adult, they need to either an adult or a child, they need to take excess water. When there is more hydration, it helps to prevent the um, plague. We call it plague, accumulation of fluid. Sorry, accumulation of the cells in tinier vessels. So when there is no plague in tinier vessels, that there is adequate fluid flow, it will prevent this plague in tinier vessels, and it will prevent pains, and it will prevent being falling sick. Then it will also prevent oxygen not getting to vital organs. So what I believe they can do is taking enough water, putting on more clothes in cold weather, getting out of rooms that are very stuffy and they are very shocky, then not staying too much in crowd, then reducing stress at work and at home. Then they need to now personally and individually study their own body. What exact condition does my body not fit in? So if they've studied themselves that this condition, I can't go with it, then they have to stop. So for someone like me now who is not even in sickle cell, I know that I can't take ice water. When I take a cold water, it makes me feel sick. I might take cold drinks, it doesn't affect me, but I can't take cold water, even when I'm not even sick. So we all need to study our body, and that is why it is easy for an elderly person not to fall sick. You see a child who has been visiting the hospital recurrently when they were younger, they will get older and not visit the hospital regularly, because now they are older, they know what suits their body and what condition doesn't suit their body. So they will begin to watch out for those precautions and observe them. So for parents who have sickle cell children and for adults who have sickle cell, they need to study their body and study the environment. I had a friend of my dad then, though he's late now. He had sickle cell, he had hypertension, and he had asthma all in one. But this man was able to live up to 60 years before he died. Why? If he should notice that the weather is getting cold, he will put on his cardigan straight up. If he should notice that the environment is becoming dusty, he will immediately get out of that environment. So he was able to do, and he was going for a regular medical checkup. So doing all that, he was able to live up to 60 years. Having one out of those three is bad. Not to now have asthma, sickle cell, and hypertension, and he was able to live long to that age. So we need to study triggers. I'll call it triggers. We need to study them and avoid them. Thank you.
Thank you very much, Dr. Adebayo. That was really in depth, I must confess. That was really in depth. And I believe that our viewers will be able to do just that. So in a nutshell, you're telling us now that this, I don't want to say it's a very bad weather for the career or for, I don't want to use that word anyway, but it is essential now for those people that we're talking about to cover up at this moment, study their body according to you, study their environment. I hope I'm right. Then they should be able to do the needful so that they will be able to minimize the occurrence of these health issues. Thank you very much once
Thank you so
again.
much, man.
So
Thank you, man.
before we bring it to a final note, there is this thing that I would like to ask. There was a time I was watching the television and I had an advertisement that there's there's a particular maybe therapy, surgery or something that they can do for a sickle cell to be evacuate. Yes, that there is a bone marrow transplant that if it is successful, that the the sickle cell
Yeah.
anemia will change to something else or something. Is there anything like that, sir? And then what is the percentage of the possibility? What's the possibility of having a perfect genotype after this transplant?
Yes, there is the possibility of that. Science has graduated to we call it stem cell transplants. Stem cell transplant. Like in the country I studied, this is what they do. You before the CS, you will sign a consent, or a vaginal delivery, you sign a consent that they should get some stem cells from your baby's placenta and put it in the bank. The advantage of that is in future, when you need a compatible donor, those cells can be picked up, taken into the lab, and multiply them and use them for whatever growth they want to use them for. So, in the case of sickle cell and stem cell transplants, science has gotten to that level where, since it's the bone marrow that produces cells, our blood cells, so, and it's because it's having a sickled one as a result of a certain amino acid that was wrongly attached with the valine in replace of another amino acid that causes sickle cell. So what they need to do is to go to the bone marrow, the stem cell area where these cells, these sickle cells are coming from, and they will replace it with a an LD one, so that when next the bone marrow are producing cells, they produce the normal cell. But the challenge of this is that it has not been widely how will I put it now, affordable, not widely practiced, very expensive. And another challenging thing is to find a donor, a compatible donor, because it's not just about taking a cell, putting it into another.
Do we lose that? Uh, we lost you along the line, so I couldn't pick what you said. Some of your statements anyway, but I'm able to pick up some things. So if you're just joining the program is Family Clinic, and this is how we do it every Sunday. And tonight we have Dr. Adebayo Adewale online with us as our guest tonight. He has been able to tell us the importance of genotype. He explains to us the types of genotype. Then he gave us some ideas on how to take care of ourselves if we fall short or we are under this genotype, and for parents too. Just as I told you, we are not going to be judgmental. We're not blaming anybody for this. We just want to make sure that we reduce, in this dispensation now, that we orientate ourselves so that people don't fall victims again. You know why I make mention of why I use that word victims? When you visit the hospital and you see the pains that these patients go through, then you will understand the reason why I use that word victim. So in order for us to put a curb to this, or put an end to this, or reduce it, or put a total stoppage to producing unhealthy children and babies, that is the reason for bringing up the topic tonight. And Dr. Adebayo has been able to do justice to it. Thank you very much once again, Dr. Adebayo, for coming on the program. You're still going to stay too, because I want to check if you have any question on the comment section for you. So if there's any question, I'm going to read out. Okay. Unibella Motola, thank you very much for coming on the program tonight. Brady Shinedu, thank you very much. Adebayo Go Taiwo, thank you very much, sir, for coming on the program tonight. Samuel Adeyemi Oyejemi, thank you very much. Adewumi Stephen Edowu, thank you very much for coming on the program. So far, so good. There's no question on the comment section for you, Dr. Adebayo. Now, to cap it all, I told you we will not be spending our normal 1 hour tonight. We're just going to be spending 30 minutes. And I believe we've been able to hit the nail on the head tonight. But on a final note now, what I noticed is that people now that fall under this genotype, there's this sort of stigmatization, or I don't know, maybe they are the one doing this to themselves. They don't come out in the open to say it. You see some people framing their genotype. Even at the verge of getting married, they don't want to open up to people about their genotype. And when they summon the courage to open up to people their genotype, there is this response they get from the society, like sickle cell. What do I have to do with sickle cell? Let me make use of our general term now. Sickle celler. You don't want to have anything to do with sickle celler, even if a man should bring a sickle cell anemia person to the family, even if the man is AA. And according to what you said it's a good match, that AA can actually go for SS and SC. You see the parents are not giving their yes to this relationship. So what advice can you give to parents? What advice can you give to would-be couples, because the wife is SC, the wife is SS, you just want to marry her out of pity, because if you don't marry her, no one will marry her. Or if you don't marry him, no one else will marry him. What advice do you have for the set of people?
Okay. Though I could not hear you, but at least I could still pick your question because the mic was off at a point. But I believe I got your question right. That what advice can we give to parents, right? Actually, I believe one thing can work, and the one thing that can work is this: enlightenment, education like this. A
The network is somehow. We can hear you now. You're back. I believe we lost the connection, but in a short while we're waiting for him to come back on camera, because we're having just a few minutes to spend on the program, just a few minutes more to spend on the program tonight. Sir, Dr. Adebayo, I believe it is the network over there. So I know you're still going to join us to give us a recap of what you just said that we missed along the line. Okay. So I think he's searching for network. Let's see. Let's wait and see how it goes.
Hello,
Yes,
ma.
I can hear you now.
Sorry, a call came in. So
Okay.
I believe a platform, something like this can help to enlighten parents. But because of where we are from, we are Africans. I believe there is little effort this can do, because I remember then when people were being enlightened about HIV, that when you start taking the drug, the person will be very healthy, can get married and not infect the partner. Some parents, even people who were given the training, those who were given the training that HIV, when you're taking your drugs, will not accept their children to marry an HIV positive person. And the child was not like, mommy, but you are the one giving this training that it's normal, you will not be infected. No. We're Africans. So there is little or no effort. But what I believe can work is that if the two partners can agree within themselves that it's not a problem, then keep it away from parents. It might sound harsh, but then since it's you two that wants to live your life, then keep it to yourself. SC, you are AA, all right. We'll keep it to ourselves. Our parents might not agree. It is your family you are about to build, not theirs. Theirs is just to give the consent of go and marry. Because I must tell you, an African parent will not agree to that. An African parent will not agree to, even if such a person is an educator on issues like this, educating other people that don't worry, it's fine, it's normal. So far the person is A, I believe such a person will not still allow his or her own child to marry a sickle cell patient. So what I believe can work is, it is imperative we know our genotype. Like I said, if you know you are S, at times parents still come here and I ask them, "Ma, what is your genotype?" And they will say, "I don't know." No, not in this generation. Everyone should know their genotype. And when you know your genotype, you know you are at the risk side. Please, if anybody should say, "How are you?" your own "I'm fine" is, what is your genotype, before you go deep into anything. And if you know that your parents might not take it, please just make it an agreement between you and your partner and get married and keep it to yourself. I believe that's what can work in Africa anyway.
Thank you very much, Dr. Adebayo. Though the time is short, but we've covered a lot, I must confess. My appreciation goes to everyone that found out time to be on the program tonight, especially to you, Dr. Adebayo, because I really don't believe you'll be coming up on the program, considering your tight schedule.
Thank you, man. I have to be here. It's an honor to be here. It's an
Thank
honor.
you very much for honoring our invite now. I
Thank
don't
you.
know, I normally don't dish out people's number on the program without their permission. So I don't know, there may be, just like I said the other time, coming out in the open to tell people that you are SC, that you are SS, coming out in the open to ask questions publicly may be somehow difficult for some people. So I don't know if you can kindly give us your number. Should there be anyone that want to ask you one or two questions concerning his or her genotype or that of their children? And if it is not convenient for you to dish out your number, since it is a public program, maybe you can just drop with us your Facebook name so that people can message you should they have any questions, sir.
Okay, ma. Actually, it's a public place, but I believe this can work. Whoever might need my contact should see you. At least that can be streamlined. They see you, you can give them my contact to make inquiries. Let them take it from you. At least that you can know who you gave it to, who you didn't give it to, so that you can control it from there.
Okay. That's a very wise one. Thank you, Dr. Adebayo Adewale, for coming on the program tonight. You can please, you can exit the live streaming now while I round up the program, but don't leave without delivering our message to Auntie. Tell her we love her. Tell her thank you for giving you to us at this hour. It's late already, and today is Sunday. Wish everybody believe that it's a time to rest against tomorrow's work. Though doctors don't rest, thank God I don't get married to one. Maybe I may not be able to.
I have an emergency now, but it's a big honor. It's a big honor for me to be here. I'm very happy. Thank you
You're
for
very
having
much
me.
welcome. So we're going to release you now. Go attend to your patient, and I pray that God will guide every of your endeavors in the name of Jesus.
Amen.
Thank you very much. Our kind regards.
Yes, ma'am. Thank you, ma'am.
Wow, it's been wonderful on the program tonight with Dr. Adebayo Adewale. He has been able to actually depth so much with our topic for tonight, the importance of knowing your genotype. I believe if you miss this edition, you will be able to watch the video on my timeline, on my account, so that you will not miss out totally. But I must confess, it is a must watch for everyone, especially those that are getting married, those that are ready for marriage, preparing for marriage, and parents that are already gotten themselves into this. I don't want to call it into this mess. You know, then people get married out of love. Love is blind, so you get married, then they don't care about genotype. Even up to now, there was a time I went to the hospital and I saw this lady that came with a child to attend the clinic. I don't want to go there. Let us leave that for tonight. My sincere appreciation to everyone that find that time to be on the program tonight. Don't leave me alone on this. You all that I see are my encouragement. Let us do this together again next week, where we shall be coming up with another interesting topic. Next week edition is one that you won't want to miss. I bet it with you. You will not want to miss it, because we will be talking about about child preference. Yes, we are talking directly to parents next week about child preference. You know, to those of us that prefer one gender to the other, or those of us that love our firstborn, those of us that love our lastborn, and so on and so forth. That is the topic we'll be teaching. We'll be discussing next week. So don't miss it, because it promises to be interesting. And let me leave you with this, please. This time, the weather is somehow cold, so try as much as possible, especially if your hemoglobin genotype SC, SS, SC, or whatever genotype that you fall under. Just make sure you keep yourself warm, especially the children. Check them up in their rooms as often as possible, especially in the midnight. Cover them up, wear them socks, let them wear the cardigan. You can cover some side of the window. Just make sure that the place is warm for them. And for daddies and mommies, you know how to go about that and warm yourself up. I believe you won't leave me alone on this. You're going to do this with me. Come next Sunday. I am Tony Olusa, the initiator of Family Clinic. You can search us up on YouTube, Family Clinic with Tony Olusa. On my Instagram handle, Tony.Olusa. On my Facebook, Tony Olusa. On Twitter, Tony Olusa. You know, we're just like this network everywhere you go. Please try and join my group on Facebook, Family Clinic. Search us up and join Family Clinic. That is where you can enjoy every bit of this program to the fullest. Thank you very much. Until next week, when we meet again. May the Lord guide every of your endeavors. Sleep good, wake strong.